friends, and today we'll be speaking about two important terms, that is potency and efficacy of a drug molecule. It's afternoon session and already I had enough lunch and I'm feeling so drowsy. Anyway, let's finish up this topic. So potency of a drug molecule is the intrinsic ability of a molecule to perform. Talks about the makeup of the molecule, how effective the molecule is made to tackle a condition or a disease. On the other hand, efficacy is something to do with the performance output of the molecule. How effective the drug molecule is to cure or remedy a particular condition. Now, if I want to explain this, I take the help of two balls. One is the tennis ball, which is made up of a material which helps the tennis ball to bounce back, because that's the requirement of the game. On the other hand, we have a cricket ball which is made up of relatively solid material, because in cricket we do not want the ball to bounce so heavily and reach the other player. So now let's play the game. I throw a tennis ball onto this road and you can see the bouncing effect of this tennis ball. In the next example now, I throw a cricket ball and you can see that the bouncing effect is less as compared to what it was with the tennis ball. But when I throw this cricket ball onto a bouncing surface like this, the bouncing effect of even the cricket ball can be increased. Now let's come back to where we were. So these three examples talk about potency and efficacy. High potency tennis ball made for bouncing, and the bouncing which was seen, the efficacy which was achieved was 100%. Very good bouncing effect. Second example, a low potency bouncing effect seen with the help of the cricket ball. Less potency, less was the efficacy. But sometimes even the less potent molecules in exactly proper conditions, if they get fit into this, they can show a very good bouncing effect, or they can be highly efficacious. So higher the potency, higher is the efficacy usually. Lower the potency, lower is the efficacy, but in some conditions even the low potency drugs can prove to be highly effective in treatment or cure of a disease. If I need to give you an example of this, we can talk about analgesic drugs, drugs which are given to reduce the pain. And we have morphine on one side and we have aspirin on the other side. Morphine is a highly potent drug. The makeup is such that it can reduce the pain, and it proves to be highly efficacious in treatment of pain related diseases or pain itself. On the other hand, aspirin is a low potency drug, does have some effect on pain, but it is nowhere comparable to what analgesic effect of morphine. We want all these drugs to compare one drug with other. We have a set of drugs which exist with us to treat or cure a disease or condition. We need to pick up the best drug possible, and usually we need to compare these drugs by two defined factors, that is potency and efficacy. Usually highly efficacious drugs are the ones which are taken into consideration. There are various angles in which you can look at potency and efficacy. If I want to show you a graphical representation of what potency would look like, then here is a graph with DRC, that is a dose response curve of drug A versus drug B. And what you can see is that the DRC onto the right side, on the dose axis, is a less potent drug as compared to the DRC on the dose axis, which is onto the left side. So here drug B is less potent as compared to the drug A, simply because it requires more amount of drug B to get to effect as compared to drug A, which requires less amount of drug. If I want to show efficacy, on the other hand, efficacy is a measure of success, so always measure in terms of height. So here is a DRC of two drugs, drug A and drug B. Higher the DRC or dose response curve, higher is the efficacy of the molecule. So drug A is having a greater height as compared to drug B, and that's the reason that drug A here is more efficacious than drug B in treatment of a particular condition. So you will get across various graphs in which you will need to look at the potency and efficacy of drug molecules. So in simpler terms, potency reflects to the right left side of the graph, whereas efficacy reflects to the height of the DRC, the maximum height achieved of a dose response curve. Higher the height, higher is the efficacy. I think that's all for this day. Thank you. Keep watching my videos and do subscribe. Bye.